name is Robert Riley, Director of Interventional Cardiology in the Complex Coronary Therapeutics program here at Overlake Medical Center. The Complex Coronary Therapeutics program really focuses towards patients with complex heart artery blockages or coronary artery disease. And by complex, I mean other people have told them that they're difficult to treat. That can often involve when multiple vessels potentially have blockages that will require different kinds of stents being placed, or 100% blockages that can be very difficult to get across and get stents there. There are other patients, though, where open heart surgery either doesn't make sense based on where their blockages are, or sometimes they're a little sick and open heart bypass surgery could be a little bit dangerous. Those are the types of patients that we often will be asked to come in and see if there are other minimally invasive types of ways to treat them, typically with stents. That's usually by inserting an IV into the blood vessel in either the arm or the leg, sometimes both. Through that, we take catheters, which are small hollow tubes, into the heart arteries where we can actually inject dye and see the artery and the blockage. We then take a series of balloons and drills and different types of things that can go in, essentially take care of the blockage. We usually, typically, not always, finish with a stent, which goes in and keeps the artery open after we've done the work to take care of the blockages. So during the procedure, we typically give you medicine to help with pain and to help with anxiety and things like that. Sometimes people go to sleep, sometimes people don't, sort of depends, and it depends on the length of the procedure too. Afterwards, you stay with us usually for a few hours, and the majority of people actually go home the same day. Chronic total occlusions occur as a severe form of heart disease where the fatty deposits build up so much that they completely block off the artery. Once that occurs, people start getting more and more symptoms over time. That can either be shortness of breath, chest pain, or a myriad of other symptoms. So I'm lucky enough to have been trained specifically in treating patients with complex heart disease, specifically with these 100% blockage or chronic total occlusions. Utilizing that training and years of experience in the past, we've been able to get our team to be able to utilize the multiple different instruments that are utilized to treat these very complex and special types of blockages. This includes both the staff, walk you through getting into the clinic, where you'll meet me and we'll have a discussion about sort of where you've come from, what things look like, what your options are, the pros and the cons. Then if we do decide to move forward, you'll meet our team in the cath lab that has been specifically trained to treat these very difficult types of blockages. You'll then have follow-up with us on the back end so that we have a 360-degree ability to follow you both through the procedure and on the back end to make sure that we take care of you the way that you want to be taken care of. Often we'll see patients that receive their care at other places where they've either been told that it was too complicated, too complex, or that they didn't need to have the procedure performed. However, unfortunately, they're still having these lifestyle limiting symptoms, so they often will search out someone who is willing, potentially able to take care of these types of blockages. That's typically how patients will make it to our program, and we're able to synthesize the care that they've had before, look at what their different options are and the pros and cons, and be able to decide what's best for that patient. Here at Overlake, we're lucky to have people specifically trained in treating these types of lesions, both physicians, staff members, and our nursing staff in the clinics. We're able to see you on the front before the procedure, during the procedure, and on the back end with specialized knowledge in treating these types of patients.